Bismillahirrahmanirrahim and Assalamualaikum warahmatullahi wabarakatuh. So we are from Group 5. We'll be presenting about alternate exotropia for Paediatric clinic case presentation.
We start with subjective first. So patient is 4 years old, female and Malay. And for the first visit on 13 March last year, 2019, she complained of left eye deviated, especially during daydreaming since 4 to 5 months ago, and no deviation detected when using phone. And she has history of ventricular septal defect.
Okay. Patient came for a follow-up of 4 sessions, for a total of 4 sessions. So the table summarized the history taking throughout the 4 sessions. So based on patient's mother, the deviation becomes smaller after each visit, and it becomes reduced more prominent after patient started wearing spectacle, which the spectacle was prescribed on the second visit, which is on the 9th of May 2019. So patient was prescribed for a therapy broad string, and patient dined once per day in the morning before she went to the nursery. Patient mother said they comply with the therapy, and hence we proceed with the assessment to monitor whether the therapy and the management given previously has affected the deviation or not.
These are the refractive examination result comparing each visit. Okay, first we look at the VA unaided. For right eye, it remained the same 6.6, and for left eye, it improved during second visit 6.18 to 6.8 during the next visit by using Sheridan at 3 meter. Okay, for VA aided, for right eye, it remained the same 6.6 during the third, fourth and fifth visit. For left eye, it fluctuates during third visit 6.6 and then 6.8 and then 6.6 minus 1. Okay, next we look at the retinoscopy result. For right eye, during first visit, this patient got plus 0.75 with seal minus 1 as is 180. She got 6.9 during her first visit, and then the power increased to the current visit minus 0.75 with seal minus 1.25 as is 180. For left eye, during first visit, she got plano, and it increased to current visit minus 175 with seal minus 2 as is 180. She got 6.9 minus 2, which is reduced from the VA added during current visit. Okay, for subjective refraction, the result that we get only during the second visit. For right eye, plano with seal minus 1.25 as is 180, she got 6.6, and for left eye, she got minus 1.25 with seal minus 125 as is 180, she got 6.9.
Since this patient came for tropia follow-up, assessment on deviation was done, which is Hirschberg and also cover test. From the previous visit, her Hirschberg shows consistent findings, which is corneal reflex displeased nasally at pupil margin. On the latest visit, her Hirschberg at distance shows corneal reflex displeased nasally, approximately 3 mm deviation, and at near, her Hirschberg shows center and symmetry when she was inattentive, but when she unattentive, her corneal reflex displays alternately nasally, approximately 1 mm. For the cover test, for the first two previous visit, her findings shows left eye small exotropia both at distance and also at near. However, her deviation become worse as her latest visit. The deviation become constant alternate exotropia at distance, and at near, her deviation become intermittent alternate XT.
To gain more information about the magnitude of tropia, prism cover test, PCT and Krimsky test were performed. First, let us see the findings of PCT at distance. During the first visit, PCT at distance cannot be done because patient was inattentive. However, during second visit, the PCT at distance was 14 to 15 base in. It increases up to 30 base in latest visit. While PCT at near, the result was fluctuating if compared from first visit. But upon latest visit, PCT at near was 16 to 18 base in. This reflects that patient's deviation is worsening instead of improving. Additionally, accommodation response test (MEM) was also performed. This patient has lack of accommodation as accommodation response for right eye is plus 1.75 diopter and left eye is plus 1.5 diopter.
So based on findings, this patient diagnosed with both eye compound myopia astigmatism as right eye got minus 0.75, SAIL minus 1.25, axis 180 with vision 66 minus 2 and left eye minus 1.75, SAIL minus 2, axis 180 with vision 69 minus 2. Next, this patient has constant alternating exotropia at distant and intermittent alternating exotropia at near. So for the management of this patient, I will pass to my friend Izati.
For management of this case, first, patient can continue wearing her current spectacles but keep in view to prescribe new prescription on the next visit if her VA is reduced. Second, patient can continue the broad string therapy to improve the vision system. The procedure of this therapy had been demonstrated, which is to start at 50 cm and moves the beads closer to the nose. She was advised to perform it 2 times per day, which is in the morning and at night instead of once per day. Then, the progress is needed to be recorded in the given form. Last but not least, patient needs to come again in 1 month to review the refraction and deviation status.
Okay, that's all from us, Group 5 for Paediatric Clinic case presentation. Thank you and Assalamualaikum warahmatullahi wabarakatuh.